Hello, and thank you for choosing Medical City Fort Worth. We are honored that the Joint Commission has recognized Medical City Fort Worth as a Gold Seal facility for the level of outstanding quality and customer service that the spine surgery program offers. We want to make sure you have all of the information that you need to prepare for your spine surgery. So let's go over what you can expect when you arrive. This will include how to prepare for surgery, nursing care, therapy services, spine precautions, and finally, discharge planning. Please be sure to keep track of any questions that you might have throughout this video. There will be a phone number at the end where someone from our outstanding staff will be happy to answer any and all of your questions. Thank you for taking the time to watch, and we look forward to meeting you.
You will receive a call from our scheduling department to ensure you are scheduled for a pre-admission testing visit. It is very important that you complete this visit 7 to 10 days prior to your scheduled surgery. If you have not received a call within 2 weeks of your surgery date, then please call us at 817-347-5898 and someone will be happy to set up your appointment. We also have walk-in appointments available Monday through Friday from 7:30 a.m. to 3:30 p.m. You will need all of the following items, so feel free to pause here and make a list. Any and all medications that you are currently taking, including over-the-counter medications and supplements, your photo identification, and your insurance card. During this appointment, a nurse will need to obtain your medical history, medications, allergies to medications, and perform any additional needed tests prior to your surgery. If you have any records from past testing, please bring them with you to the appointment. Please plan accordingly for this appointment because it could last 1 to 2 hours, depending on the amount of testing needed. Also, during this appointment, you will be given the time of your surgery, what medications to take the morning of the procedure, and a special soap to use prior to surgery. This soap is very important because it is the first line of defense to avoid infection. This soap must be used both the night before and the morning of your surgery. Wash yourself from the neck down, avoiding your private areas, and pay special attention to the area where your surgery will be performed. If you cannot reach that area, please have someone assist you. The soap should stay on for 2 minutes prior to rinsing. Please avoid fragrant lotions and deodorant as these things could interfere with the effectiveness of the soap. In preparation for your surgery, we recommend that you stop taking all blood thinning medication and/or supplements 5 to 7 days prior to your scheduled surgery date. Make sure that you consult with your prescribing physician and surgeon before you stop taking this medication. The doctor and surgeon will consult with each other to make sure you safely wean off of the medication before surgery. Keep in mind that over-the-counter medications such as aspirin and supplements such as fish oil can have a blood thinning effect, and you will need to stop taking these 5 to 7 days before surgery as well. You will be given a list of blood thinning products during your visit. We also strongly encourage you to refrain from nicotine and nicotine products. These will slow down the healing process. It is important to prepare your home and set up a support system prior to surgery. We recommend that someone stay with you for at least the first week after surgery. You will not be able to drive upon discharge from the hospital, so please have rides pre-planned. In addition, here are some steps you can take to prepare your home. Remove any potential trip hazards such as throw rugs, cords, and have a plan for animals if they tend to run under your feet. Add night lights in the area you will be staying. Move dishes, pots and pans, and anything else you will need to waist level. Put clean linens on your bed and prepare meals. Make arrangements for small children and animals if they require lifting due to the lifting precautions after surgery. And set up your shower environment with the long-handled sponge or loofah and have a place to sit in the shower. The night before your surgery, make sure to use the soap provided and do not eat or drink after the time instructed during your pre-admit testing visit, which is usually midnight.
When the morning of your surgery arrives, make sure to use your soap and take all of your medications as directed during your pre-admission visit. It is very important that you do not eat or drink anything, including gum or mints. Everything you wear should be loose and comfortable, and if your surgeon gave you a brace, then make sure you bring it with you. Please leave all of your valuables at home. You are welcome to park in the front lot of the hospital, but we also provide a complimentary valet service, which is available Monday through Friday from 7 a.m. to 7 p.m. Once you have arrived inside, you will need to check in at our information desk. They will assist in guiding you to our pre-op area located on the second floor. Once you have arrived in pre-op, your nurse will review your medical history with you to make sure that everything is accurate. You will then change into a gown. We will start an IV for fluids and apply compression sleeves to your legs. If you have any allergies, it is at this time your nurse will place an allergy band around your wrist. This is when you will meet your anesthesiologist and the surgical nurse. Your surgeon will also come by to answer any additional questions that you may have. This is also when several accuracy checks will be performed. These are done preoperatively to prevent errors by asking you about your surgery, your allergies, your name, and date of birth. These are asked several times. We allow 1 or 2 friends or family members to wait with you as you prepare for surgery. But when you leave for surgery, the guests will need to wait in the waiting room located on the 2nd floor. A nurse will help them to the waiting room and make sure they get checked in at the desk. There is a cafeteria on the 1st floor, which is open from 7 a.m. to 2 p.m., and there is also a Subway sandwich location in the cafeteria that remains open until 11 p.m. Once you have arrived in the operating room, your general anesthesia will begin. In our operating room, sterile technique is used to aid in the prevention of infection. If a urinary catheter is required, then it will be placed in the operating room. If placed, it will be removed in the operating room or once you arrive to the neurosurgical unit. In most cases, it will be removed within 48 hours. After 48 hours, a catheter can increase your risk of infection, so the nursing staff and physician will assess your mobility and will remove it as soon as possible. The time of surgery can range from 1 to 6 hours, depending on the type and how many spinal levels are being repaired. The surgeon will speak to your family after surgery is complete, and throughout the surgery, our OR staff will send text messages to keep the family updated. Once your surgery has been completed, you will move to recovery, where you will remain until you wake up from anesthesia, your pain is controlled, and your vital signs normalize. This could take 1 to 3 hours. We restrict visitors in the recovery room due to privacy and space, so please let your family know that after they speak with the surgeon, there will still be some time before they see you on the unit. If you are having same-day surgery, after recovery, you will return to the pre-op area where you started the day. Nurses will review discharge instructions, answer questions about your brace, and ensure your pain is managed. Once you are tolerating liquids and using the restroom, the nurse will discharge you home with your medication prescriptions. Please make sure to have a friend or family member ready to drive you home. Most people who have spine surgery go to our neurosurgical medical surgical unit after being discharged from recovery. On the neurosurgical unit, all our rooms are private, all our nurses are RNs, and all of the staff have special training in caring for patients who have had spine procedures. There are no set visiting hours, and if you would like to have a family member stay the night, they are welcome as long as they are over the age of 16. We can provide a pull-out cot and linens for their stay.
While you are on the unit, there will be several medical devices in your room. Let's review some of the possible equipment that you could see during your stay. When you arrive in your room, a nurse will provide you with an admission folder. In this packet, you will find information about our hospital, a tracking sheet for your incentive spirometer, and frequently asked questions. We want to make sure you have time to review this education before you are discharged to ensure any concerns you have are addressed. The nurse will also provide your discharge instructions so you have time to review these prior to your actual discharge. At Medical City Fort Worth, a trained professional will check on you every hour to ensure you have the things that you need. Don't worry, we want you to rest. So if you're sleeping, we will not wake you unless it's necessary. During these rounds, please feel free to ask for anything that you may need. We want to address any concerns in a timely manner, so please don't wait until rounds if you need to request something. Simply press the red button on the call light to contact the nurse. The call light also controls the TV and the overhead lights. As you awake from surgery, you will notice an oxygen tube in your nose. This is called a nasal cannula, and it provides oxygen to you for the first 12 to 24 hours after the surgery. It's normal for the patient to require oxygen after surgery due to the use of anesthesia. Respiratory therapy will be monitoring your oxygen saturation and will discontinue the oxygen once the anesthesia is out of your system. Respiratory therapy will provide an incentive spirometer, also called an IS, and set a goal for you. They will teach you how to use your IS and will ask you to continue to perform 10 deep breaths every hour that you are awake. It is very important that you follow these instructions as they counteract the effects of anesthesia and also prevent fluid from building up in your lungs. A tracking sheet can be located inside your admissions packet that can be used to track your goal of 10 deep breaths per hour that you are awake. You may also have a pulse oximeter after surgery. This is a device connected to your finger and will alarm if your oxygen saturation gets low. If you find this machine continues to beep or wakes you up beeping, please contact the nurse using your call light. You will be given an IV line prior to surgery that will help deliver fluids and medications during your hospital stay. If your IV begins to beep for any reason, press the call light so your nurse can correct the problem. We may stop delivering fluids and medications a couple of days prior to discharge, so you can begin taking them by mouth. In some cases, you may have a PCA pump. PCA stands for Patient-Controlled Analgesia, and this device allows you to control when you receive pain medication. By pressing the button on the PCA, you will receive a small dose of pain medication. A beep means the medication was delivered. No beep means that it was too soon and none was received. A sequential compression device, or SCD, will be used throughout your entire hospital stay. Placed either around your feet or lower legs, the SCDs will compress and release and are important to help decrease the risk of blood clots. They must be worn while you are in the hospital bed. After some surgeries, there may be a drain placed to help with the healing process. A nurse will be tracking the drainage and will help you manage these drains during movement. In most cases, these drains will be removed prior to discharge. We want to protect the integrity of your spine surgery and do everything we can to help prevent you from falling. In order to accomplish that, there are a few rules for you to follow during your stay. You must call a nurse each time you get up. You must call a nurse to help you walk, and you also must call a nurse when you get out of bed. This must be done without exception, even if you feel like you can do them on your own. You are taking new medications and are connected to medical equipment that may have trip hazards, so please don't risk attempting any of this on your own. When we come to help, you will notice the nurse or therapist using non-skid socks and a belt called a gait belt. The socks help prevent slips, and the belt allows us to protect the integrity of your surgery should you start to fall. As discussed prior, it is important to prepare your home and keep it free of trip hazards as well. You may have a brace after surgery. If the brace is not placed during the surgery, the physical therapist will help fit and place the brace during their evaluation. They will review how to use your brace, including care for your brace and skin, and when to wear your brace after surgery. Your surgeon will also specify brace use in their discharge instructions.
An expected outcome from most surgeries is pain, and we grade your pain level on a scale. Our scale ranges from 0, which is no pain at all, to 10, which is the worst pain imaginable. Our staff will check your pain level several times throughout your stay, and it is important to let us know how you are doing. We want to keep your pain at a functional level so you have the ability to participate in therapy and other tasks needed for recovery. It is important to work with your nurse on a plan for pain medication because it is easier to maintain a 4 on the pain scale than it is to lower your pain from a 9. Let us know if the pain plan is not working for you. It's helpful if you can describe the type of pain you are having, as most pain medications target a specific type of pain. The description of the pain will assist the surgeon in adjusting or adding your medication. Let's talk about the different types of pain you might experience. The first type is surgical pain. This is usually described as a deep and throbbing pain localized to the incision area. The second type is muscular pain. Muscular pain is commonly referred to as muscle tightness, spasm, or Charlie horse. If you begin to notice tightness in the muscles around the surgical site, please let us know. The last type of pain is nerve pain. This is most likely what you have been experiencing prior to surgery and tends to radiate and be described as a pins and needles sensation. The nurse will review side effects of medications when he or she gives them, but one typical side effect of pain medication is constipation. We have several options for treating constipation in the hospital should you need. If you continue to have problems, try some over-the-counter products and make sure you are getting enough fiber in your diet on a daily basis. If constipation continues after you have tried over-the-counter medications, please let your surgeon know. In addition to medication, there are several non-medicinal treatments you can utilize to aid in decreasing pain, whether that is listening to music, reading a book, or watching a movie. We would like to encourage you to bring anything that you know works as a pain distraction with you. We also have word puzzles, magazines, books, an imagery channel, ice, and pet therapy, where dogs come to visit patients in their rooms available to you. If you like any of these options or there's something we can do to make you more comfortable, please let us know.
Anytime surgery is performed, there are risks associated with that surgery. Though rare, we would like to review possible complications and how they present themselves and what to do if you notice any of these symptoms. The first possible complication is infection. The signs and symptoms of an infection is a red and hot area at or around the incision. Also changes in color or the amount of drainage accompanied with a fever. After surgery, we anticipate the surgical area to be irritated and tender because you just had surgery. However, if you notice the area getting worse, a change in drainage, or a fever, please alert your surgeon. There are several things we can do to prevent infection. It all starts with this soap you received during your pre-admission testing visit. In addition to cleansing with the soap the night before and the morning of your surgery, our team will cleanse the surgical area prior to surgery. Antibiotics will be given through your IV before surgery and during recovery. The surgery will be performed using a sterile technique, and urinary catheters will be removed as soon as possible. The most important part of infection prevention is hand hygiene. There will be hand gel placed outside each door that everyone should use prior to entering the room. Please ask any visitors or family members to use this gel when they enter the room. Prior to discharge, your nurse will review incision care and the importance of washing your hands prior to changing your dressings. Please follow your instructions for showering and bathing. We ask that you do not submerge your incision in water until cleared by the surgeon. In most cases, the surgeon will allow you to take a shower, but check your specific discharge instructions for timeframes and any other restrictions. The second possible complication is blood clots. Blood clots present themselves as a red, hot, swollen, and painful area. The most common location for this to occur is in the calf. If you notice a red and painful area in the calf, which increases in pain with pressure or bringing your foot toward you, please alert your surgeon. Blood clots will be confirmed through an ultrasound, and if positive, blood thinners will be started. There are several things that can be done for blood clot prevention. The first is the use of your sequential compression devices, or SCDs. Please have these on while you are in bed at the hospital. Performing ankle pumps, where you move your ankles up and down, is effective in blood clot prevention as it helps pump blood up to your heart. Walking is the most effective way to prevent blood clots. You will see therapy while in the hospital, and they will help you start this process and work with you to develop a walking program to continue at home. In rare cases, it is possible to have a blood clot and not be aware. In this instance, you would not know you had a blood clot until it moves. Blood clots will typically move into your lungs, which is called a pulmonary embolism, and it can be life-threatening. If you notice chest pain or shortness of breath, please call 911 and go to the nearest emergency room. The last complication we will review is pneumonia. The signs and symptoms of pneumonia are shortness of breath with a cough and a fever. If you have these symptoms, please let your surgeon know. Pneumonia can be prevented by walking and doing breathing exercises. The incentive barometer we discussed earlier will be used for breathing exercises.
One of the most important predictors of successful surgery is how soon a patient can get moving after surgery. Therapy is here to assist you with moving and will get you up as soon as it's safe to do so. Typically, this will occur the day of the surgery. Your physical therapist will assist you in getting up and possibly walking a short distance. Starting the day after surgery and the rest of the time you're in the hospital, you will receive both physical therapy and occupational therapy. Physical therapy will focus on your overall mobility. Occupational therapy will focus on activities of daily living like dressing and bathing safely within your spine precautions. Please bring a change of comfortable clothes and shoes so occupational therapy can practice these tasks with you. During your therapy treatment, they will also review your brace orders, how to care for your brace, and give you instructions on how to apply the brace and take it off safely. You will have spine precautions after your surgery, and they are important to allow the spine to heal and to prevent hardware failure. Bone will grow around the hardware, making it more stable, and precautions will be lifted. But bone growth takes time. For lower spine and lumbar surgery, we use the acronym BLT. B, no bending the spine in any directions. L, no lifting anything more than 5 to 10 pounds. And T, no twisting of the spine. Your surgeon will let you know when it's okay to restart these activities. With these spine precautions, it's important to use a log roll to get in and out of bed. A log roll will be taught to you by your therapist during your stay in the hospital. Other things to keep in mind are your sleeping and sitting positions. While lying on your back, use a pillow under your knees to reduce stress on your back. While lying on your side, place a pillow between your legs to help your spine stay in a neutral, supported position. Sitting is one of the most taxing positions for the spine. Your therapist will work with you on increasing your sitting tolerance. When sitting, it is important to support the spine by using a chair that has a back and scoot all the way in the back of the chair. You can use a towel roll to support your spine. Avoid sitting on low surfaces as it makes it difficult to stand up and may lead you to breaking your precautions trying to get up from a low chair or couch. Also avoid sitting in the same position for long periods of time. Typically, we ask that you change your position every 30 minutes to an hour. You can change your position by reclining or adding pillows under your arms or behind your back for support. Another great way to change your position is by getting up to walk. For neck surgery, the precautions follow the same BLT acronym. Avoid bending your neck in any direction. Avoid lifting anything more than 5 to 10 pounds. Avoid twisting your neck for any reason. In addition to BLT, we ask that you avoid repeated overhead activities. A log roll is also recommended to get in and out of bed during recovery. Keep your head in a neutral position while resting, and be careful of the size of your pillow. A pillow too big or too small could cause you to break precautions. For all surgery, your exercise will be initially limited. The therapist will give you a walking program and possibly a few exercises you can do in bed or in a chair. As you progress and your spine precautions are lifted, your activity will increase. Your surgeon may have you follow up with an outpatient therapist after several weeks to help you get back to your normal activities and progress your exercise. During your therapy in the hospital, the therapist will assess your need for equipment. If equipment is needed, the therapist will give you some resources on where to find the needed equipment. If you use equipment currently, like a cane or walker, please bring that in with you and place your name on the device.
During your stay at Medical City Fort Worth, a case manager or social worker will review your charts, talk to you about your home environment, and will also help arrange any needed post-acute services. In most cases, you will go home after the surgery. If you need minimal assistance with mobility, home health therapy can be ordered to assist with mobility training and safety in the home. In some cases, you may have a preferred company that you have worked with in the past. We would like to know your selection as soon as possible. If you know prior to your surgery, please ask for a discharge planning form when you come in for your pre-admission testing visit and make your selection there. This form will be faxed to our case management team so that they are aware of your choice prior to your admission. Typically, home health will work with you 2 to 3 times a week for an hour each session. Since they will not be there at all times, please make arrangements to have someone stay with you to assist at home after the surgery. Depending on your case and physical condition, sometimes additional care is needed. Your care team will assess your needs to help make recommendations and ensure a safe transition from our hospital.
Thank you for taking the time to watch this video. We strive to make this a seamless process for you. If you have any additional questions, we would love to hear from you. You can contact our spine manager at 817-347-6084. Thank you again for joining us and learning what to expect during your surgery. And as always, thank you for choosing Medical City Fort Worth.